Hello, I will be talking to you today about how to do a lumbar puncture, or LP for short. The indications, contraindication, tools and equipment, steps of procedure, and complications will all be discussed, followed by an actual demonstration of how to do this procedure. The first recorded LP was done all the way back in 1890, and we are still using it today as a diagnostic tool and for therapeutic means. A LP is a needle puncture of the spinal cord, usually at L3, L4, or L4, L5 interspace, which cerebral spinal fluid, or CSF for short, is sampled and pressure is measured. We'll begin by discussing the indications for doing this procedure, including its use as a diagnostic tool used with suspicion of bacterial, viral, or fungal meningitis, encephalitis, hemorrhage, and CNS disease such as Guillain-Barré and multiple sclerosis. It is also used in the diagnosis of CNS malignancies and is indicated for therapeutic use in the reduction of intracranial pressure. Another indication is to perform a lumbar puncture so that intrathecal medications such as antibiotics, chemotherapy, and anesthetics may be administered. Now we will discuss contraindications for the procedure. LP is contraindicated in those with increased intracranial pressures. There is increased risk of herniation through the foramen magnum. Also, skin or soft tissue infection at the insertion area, or in a patient with papilledema. Relative contraindications in patient with history of prior lumbar surgery or any bone disorders like osteomyelitis or degenerative disease. You have to be careful. Patient with coagulopathy or suspected coagulopathy such as hemophilia as well. Also, when a mass or lesion is suspected at the insertion site. It is suggested that a CT scan is obtained prior to the LP procedure. So before we view the procedure, let's go over the equipment that you will need, including PPE. Having an assistant is always helpful when doing an LP. The tray setup for the LP includes 3 sterile skin swabs or sponges, 1% lidocaine for anesthetic, skin cleansing solutions such as povidone iodine, a fenestrated drape, 3 milliliter syringe, sterile bandages and gauze, 20 and 25 gauge needles, 4 sample collection tubes that are numbered and capped, a pressure manometer with stopcock, which we won't be using today, and last but not least, a 20 to 22 gauge spinal needle with stylet. Proper PPE is also very important. Sterile gloves, surgical mask, and eyewear should be worn and hair tied back. Depending on the setting, total PPE may be worn including gown. For the purpose of this video demo, gloves and gown will be worn and everything else omitted. Always explain the procedure, benefits, risks, complications, and alternative options to the patient and obtain a signed, informed consent before beginning. A lumbar puncture is typically done between L3, L4, or L4, L5 interspace. It is important to have the patient sitting with spine flexed or laying left lateral decubitus with knees drawn towards the chest, again flexing the spine. This helps create more space for your needle entrance into the subarachnoid space. It is important before putting on sterile gloves to locate L4. You can do this by finding the iliac crest, which will be even with L4. And now we will walk through a quick demo. As stated, begin by locating the iliac crest and finding L4. Mark the location either between L4 and L5 or L4 and L3. Next, using sponge and skin cleansing solution, swab and clean the area using concentric circles, extending all the way over the iliac crests. This action is to be repeated 3 times using each of the sponges or swabs. Next, place the fenestrated drape over the marked area of the patient's back. Make sure sample tubes are within easy reach and are placed in proper order. Prepare anesthetic lidocaine 3 ml syringe with needle, rechecking the position through the drape to repeat identification of L4 and make sure you're in the right space. Placing the needle just under the skin overlying your marked interspace insertion site, create a wheel of anesthetic and insert the needle into the interspace and continue to inject the anesthetic. Withdraw with a quick, smooth motion. While waiting for the area to anesthetize, gather spinal needle with stylet. Remove the stylet and make sure it smoothly moves in and out. Next, make sure the bevel is toward one hip or the other. The bevel is parallel to the dural fibers, which will separate them instead of cutting them. Next, insert the spinal needle at an angle toward the umbilicus in clean, marked, and anesthetized area. Insert the needle slowly, advance until you feel a popping sensation, and advancing becomes a little easier there. Stop. Remove the stylet. CSF should flow. Collect about 1 milliliter of CSF in each collection tube. Replace the stylet. Carefully remove the needle with quick controlled motion. Apply sterile gauze and hold pressure for several minutes. Then clean the area once more with skin cleansing solution. And apply cleansing. Now a little about complications that can result. The most common complication is called a post-LP headache, described as a throbbing or pressure-like headache that is exacerbated by sitting up. As such, it is advised that after a procedure, the patient remain lying supine for 1 hour to minimize this. Dizziness, nausea, vomiting is also encountered, as well as back discomfort, also noted at the insertion site. Infection is possible, especially if proper antiseptic technique is not used. Rare complications include significant bleeding and, of course, as stated before, herniation into the foramen is possible, just to name a few. Thank you for watching this short video on how to perform a lumbar puncture.